When it comes to containing costs in healthcare, everyone has their 2 cents to give. But what do those of us in the business of health insurance have to say? This is Health Sense, and I'm your host, attorney Adam Russo, CEO and co-founder of the FIA Group, a firm with over 25 years experience navigating this ever-changing industry. Join me and my guests as we make sense of effective ways to reduce the skyrocketing cost of healthcare while improving quality outcomes for patients. The only thing it will cost you is 30 minutes of your time. So let's get right to the bottom line and reimagine what healthcare could be. Hello, everybody, and welcome to the second episode of Health Sense with attorney Adam Russo. It was a blast doing the first episode. Lots of people have been dialing in, get a lot of contact. People I haven't talked to in years have reached out to me, and they all say the same thing. You're still that loudmouth with the thick Boston accent. I go, that's never going to change, right? I'm losing more hair, getting older, but luckily I have a great doctor that takes care of me. We're going to talk about him in a second. Folks, don't forget, this entire show is about edutainment. I want you to learn something new about the healthcare industry, about your own health, but also have a few laughs as well. You know, folks, I keep thinking about this because I had to send something to a hospital today. We are the only industry in the world, I think, that still uses fax machines. And I also think, I think the fax machine industry, we must subsidize their entire revenue stream, like just our industry. In addition, unlike everyone else, I can't remember the last time I actually mailed a letter to somebody, right? Or a postcard. We still mail letters in healthcare. Everything is with a stamp. So why am I bringing that up? Because what I'm talking about today is direct primary care. It's almost like a back to the future idea of how to treat individuals, right? I'm going to call it the hot tub time machine or the old school way of offering medicine. Today's guest is Dr. Michael Tremblay, who not only is one of the best doctors around, one of the pioneers when it comes to direct primary care, he's my personal doctor. Yes, I don't mind if he shares all my PHI. It might be a couple things, Doc, you might not want to say. But not only is he my doctor, he's my entire family's doctor. All 4 of my kids, my wife, my Uncle Derek, my Nana, my mom, my sister, when she comes home from Amsterdam. This guy takes care of all of us. And just want to welcome Dr. Tremblay. Welcome to Health Sense with Adam Russo.
Thanks, Adam. Appreciate you having me on.
So, Doc, give us a little background about your life, how you became a doctor, and how you ended up here today talking to me.
Well, started out as a phys ed teacher, actually, and then I took some physical therapy courses like that. And then when I was in physical therapy school, I was sitting right next to the doctors, taking all the same courses, and I said, why should I let these guys tell me what to do? I'm just going to go on to become a doctor, and I can tell myself what to do.
I mean, that's what everyone does, right? Like, oh, why am I going to listen to these guys? I'm just going to become an airline pilot. I'm going to become a mechanic tomorrow. So you went to med school, and what happened from there?
So I wanted to become an osteopath, which is somebody who can also do spinal manipulation. So I went to medical school, spent 4 years there, had a couple of kids during that time, and I did my residency in family medicine. And then I had to do a 4-year public health service obligation down in Arkansas. So I spent 4 years in Hope, Arkansas, home of Bill Clinton. And
is it really?
Yeah.
Did you ever meet him?
Never met him because he was leaving to. Actually, he didn't live in that town anymore. So he was the governor at the time. So he was living in Little Rock. So no, never met him. But I learned a lot. It was a great experience being in Arkansas for 4 years because you had to do everything.
So speaking of, you mentioned the public health scholarship. What's that? What is that?
So back in the day, the government, if you didn't have a lot of money, you could apply to the government to have them help pay your medical school bills and give you a stipend. And then you would have to go and practice medicine for 4 years wherever they said go. And they said, go to Arkansas.
So is it primarily rural places that have less doctors per capita?
Correct. Yes.
Is that program still around?
It's not. Matter of fact, it got defunded when I was in my residency program. So I ended up having to go start my own practice in Arkansas. I w wasn't even given a position where I could get a salary. So I ended up which was another great experience. I got to learn how to start up a practice, and so that was good experience for what I'm doing now.
Well, it's pretty interesting because, there's a massive shortage, correct,
Yep.
in primary care physicians, especially in rural areas like in Arkansas,
Yep.
right? Why is there such a big shortage, in your opinion?
Well, because medical school is expensive, and if med students do the math, when you get out of your residency, you want to be able to pay off your expenses as quickly as you can, and primary care doctors don't get paid much.
I mean, there's a I mean, I saw some numbers talking about almost like a 150 to $200,000 difference
Yeah, it
in
can
what a
be.
doctor can make being a specialist or like a spinal specialist or any specialist versus a primary care physician.
Yeah, there can be a $500,000 difference.
And also, I'm noticing here, it says here, and this is according to the Association of American Medical Colleges, that not only is there a massive shortage, they're telling me what it says is 86,000 physician shortage within 10 years. And if you actually looked at the rural communities, you would need another 202,000 physicians just to give the same number of physicians per capita across the country as you would in urban places. And doctors are getting older too. So obviously there's a major problem with that. Now, that's not why I brought you on. You're not an old man. You still look good. What is direct primary care for all of our listeners that don't know what it is? And how is it different than traditional care that they get when they go to, the office and see their primary care doctor?
So direct primary care, what we do is we opt out of all insurances, so we don't bill insurance for anything. Our patients don't use their insurance card to see us or for anything that we do in the office. They use their insurance card to pay for their specialist or to go to the emergency room or to get their medications. But they pay us a relatively modest monthly fee. Ours averages out about $80 a month, and then we provide all their primary care. For that, they can text us, they can email us, they can call us. We have same day visits. And unlike concierge medicine, this is medicine that's affordable. And that's the way I always wanted to keep this. I didn't want to do concierge. Concierge medicine, they charge, thousands and thousands of dollars for the yearly fee, and they still bill the patient's insurance. So we don't do that. And so that's basically what direct primary care is.
Okay, so what you're telling me is you pay a flat monthly rate. So how we do it with our family is I have a monthly rate which is much, different than my children, right? I think on average it's in the $50 to $60 range a month for kids,
Mhm.
more of like $80 to $100 for adults. And if I see you 3 times, I pay that $100. If I don't see you at all, I pay the $100. But there's no copay. There's no bill. So when I see you and you treat me, there's not a separate copay that I have to pay you or a separate bill that you're submitting to the insurance company, right?
That's correct.
So what are the services? Try to give the audience a contrast between what the experience is like, because I know I could do it. What the experience is like walking into your place, everything from setting the appointment and the services that you could provide versus that same person calling up their primary care physician's office, making an appointment, what that experience is like, and the services they get from the actual physician, not from the lab, not from someone else. If you could do a contrast between the two for our audience, that'd be fantastic.
We actually are picking up a lot more patients nowadays because when the patients call us, they talk to me. When they call their traditional primary care doctor in their insurance, not only can they not talk to that doctor, but they can't get in to see him for 6 months if they're lucky. So that's one difference right there. I'll give you a couple examples. I had a patient who had a stroke in another state, and very, very complicated patient. And they made he was moving back to Massachusetts. He came in to see us with his entire family. We spent an hour and a half with him. got answered all of his questions, got him set up with all the specialists he needed to be set up with, and we needed that hour and a half. I'd never be able to do that in a traditional practice. And we have same day visits, so we've had patients that would get a cut on their wrist, and instead of going to the emergency room, they just come here, and we can sew them up, or we can use the skin super glue, so they don't have a co-payment at the emergency room. They don't have an emergency room payment. If it's a workman's compensation thing, they don't have to go through workman's comp for any of that stuff. So that saves the system money. So those are some of the differences, I think.
Well, here's an example. So when I see you, I remember I had to go see Dr. Tremblay a couple weeks ago. I literally thought I was going to die. I know I'm exaggerating, right? I'm very dramatic. But let me tell you what I'll never forget about that visit. One, you walked in with a cup of soup for me. And folks, I'm not getting any money from these guys, but the company's called Brodo. I drink a cup every single day. The garlic one is my favorite, by the way. But that's something that blew me away. Like, you walked in with a cup of soup and said, well, actually a cup of bone broth, and said, here, Adam, try this. I drink this every single day. You showed me the name of the company. What are those little differences? What are those nuances that you bring that you don't see any longer in the traditional healthcare setting?
Well, we make home visits if somebody can't make it into the office. So that's something that's not done hardly any place anymore. We have I've got nurse practitioners who can help take care of our female patients. I've women in the office who have their own children. So when little ones come in, they give them the extra TLC for that. We do video chats during COVID. We never missed a beat. We did video chats with our patients, and because that's built right into our electronic health record. So we're a family business. My wife works here, my son works here, if the staff needs time off for something, well, one of our staff's son was sick the other day, and so she had to stay home. So we just changed all of her visits to virtual visits so she could stay home with her sick son.
I mean, that's another thing too. Like, so folks, as a CEO of the FIA group, I give my employees and their families free access to not only Dr. Tremblay, but wherever they're located in the country to direct primary care. And one of the key features as an employer that we have noticed is people don't have to take a whole day off to go visit their doctor. Many times, like you said, you're able to take care of things on a FaceTime call or over the phone or via text versus someone have to take a half day to make an appointment to go see their doctor or take their kids to the doctor. And that's a big benefit as well. Now, what was the defining moment, if there was one, where you knew that the traditional path of primary care just wasn't working for you? Was there a moment in time, like I had that experience with you with the Brodo?
Mhm.
What was that moment in time for you that said, I got to figure out another way to do this?
Well, I'll tell you, it was kind of interesting. I was walking into my traditional medical practice one day, and one of my patients was coming out of the door, and he looked at me and he said, "Doc, what's wrong?" He said, "Your head is down, your shoulders are down." He said, and I said, "Oh, I'm fine." I went in and I started thinking about it, and I realized that I was on a treadmill. I was seeing 25 to 30 patients a day. I wasn't happy about it. I couldn't spend any time with anyone. I had a panel of 3,000 patients, half of whom I didn't know. Um, and I was ready to quit. I was going to retire, and then I found out about this model, and then I started doing my homework. Jeffrey Gold, who you know is a good friend of yours, I went up and talked with him, and I talked with a few other folks who had just started this because it was brand new to this state. So we've been doing this for 8 years now, and I said I can do this. Well, it took me a year to put everything together, and after I got everything together, I sold my house and I sold my office building to fund the startup. And and here we are 8 years later, and we're in a new office in Braintree, and we're loving it.
So it's amazing you said like you had a patient asking you what's wrong with you. Yeah, I would think that's a turning point, huh? For
Mhm.
someone's life. Now, you talked about how, you sold your art, you sold your building, you had to raise money in order to start and fund this direct primary care office. What were the biggest challenges for you when you first started out? And what are the challenges that you continue to have?
So some of the first challenges were money, obviously. I mean, I also wanted to have a lifestyle. I wanted to be able to take some time off. So I brought my nurse practitioner with me. So I had to pay her salary. Now I had to pay rent. So I just didn't take a salary for a couple of years. But I didn't care. I was happy, because I was finally doing something that made sense, that made me feel good, make my patients feel good. But so that was the startup pains. But I would say that the toughest part right now is that most of the people in Massachusetts have HMOs. So if they join us and they have an HMO, we can't do referrals. So we can't send them to specialists because we're not in their network. And it's a silly law. I don't know it's still on the books, but we've been working with the Congress in Massachusetts to try to get that law changed. And we've been working for the last couple of years with that. The Congress folks, we have a bill before Congress right now with 10 co-sponsors right now to try to get that changed. And hopefully this year it'll go through. And if it does, that's going to open the floodgates for other people to go into direct primary care without that same problem.
How many other states have similar type laws that limit your ability to refer people to specialists in an HMO setting?
I think ours is kind of unique because because of Romney Care. Everybody has to have insurance in Massachusetts. A lot of states don't have that. Maine did have this problem, but they passed this law in Maine about
Oh,
4 years ago. So it's called an any willing provider law. So you don't have to be in there. So the bill that we're putting in front of Congress is kind of built around the Maine bill.
I'm assuming the lobbyists that are opposed to this are tied to the HMOs, correct? And what is it
Probably.
that they're afraid of?
I don't know because it doesn't really make any sense because we're only going to be referring to the specialists that are in their plan anyway. So I don't know what they're afraid of.
Now, how about individual consumers, the customer? That must be a challenge just to educate them as to what you do and how it all works. For example, blood work. I mean, you do blood work in your office.
Yep.
You're not sending me to a different floor or a different building. So is that a major challenge for you, just educating people to understand that the entire healthcare process that they've had over the past 20, 30 years with you, just you got to forget about all that. It's a total different world.
Yeah, so when we do lab work and we do draw blood right here in the office, we do a lot of procedures in the office that many offices don't do. But um, the patients can choose to use their insurance for that lab work. If they have a high deductible plan, they want to pay cash for it. We can do what's normally billed $2,000 through insurance. We can do that lab work because we have a special discount through Quest through our direct primary care national organization. We can do that same amount of lab work for $250.
2,000 compared to 250.
Correct.
And people typically have five, six, seven, $8,000 deductibles.
Right.
And that's their money.
hmm
Wow. I mean, when you say that to people, are they just like blown away?
They're ecstatic.
I would say so, right?
Yeah.
So obviously, there aren't many direct primary care docs still in Massachusetts, even nationally. I know it's growing,
Yep.
but what is the biggest reason why every doctor, even current primary care physicians, what stops somebody from taking the leap and joining you?
Fear. Doctors are like most other human beings. They don't like change, right? And a lot of them are worried about the money aspect of it. Um, Texas, California, and Florida have the highest per capita DPC practices, and I think it's because people are more open to things in those areas, and there aren't the regulations in those states that we have here in Massachusetts. So I think doctors are fearsome. I think they're all envious of how we practice here, but They-
Stop there. Stop there. Envious. Why? What are they envious about?
because I'm seeing 6 to 7 patients a day instead of 30.
And you actually know your patients.
Exactly. Yeah.
So give me an example of that. How many patients, would you say you should comfortably be able to have in your, it's like, customer list versus what it was like or what it is like in a primary care setting?
So my goal is 400 patients per provider. And so since we have the equivalent of 3 providers, I think 1,200 should be our magic number. Right now we have close to 900. So once we get to 1,200, we'll have a wait list. But if you're in a regular traditional practice, you can have 6,000 patients. You don't know anybody.
Wait a second. 400 to 6,000.
Right.
Is that real?
It's crazy. It's crazy.
So there are doctors doing what you're doing, primary care doctors that have 2, 3, 4, 5, 6,000 patients
Correct.
that are on their rolls.
Yep.
And they see these people on average how long in a typical visit?
Oh, probably 10 minutes.
And what's your average time that you spend with those patients every
We
day?
we schedule an hour for everyone. So I mean, everyone doesn't need an hour,
Right.
but we schedule an hour for everyone. So if they come in and besides getting their back adjusted, if they need to talk about their relationship with their significant other, we have time to do that. If they, so we can talk about multiple different things and still have time to do our documentation. When you in traditional practice, you have 10 minutes with the patients. You have 5 minutes to attempt to do documentation because then you have the next patient. And then when you go home, you got about 2 hours more of documentation once you get home. It's no wonder primary care doctors don't want to do what we're doing.
The crazy thing is, to give you a good example, folks. So when I went to see Dr. Tremblay, not only did he take care of my illness, he asked me, how you feeling? I go, I have a lot of stress, as a CEO. And the first thing you said to me was 90% of CEOs meditate. And you gave me a website to go to, an app, and I've been doing it. Okay. I actually bought as you know, my wife's a gallery artist. I actually bought a painting at a gallery show that for whatever reason, I looked at it and it just calmed me down. And I spend 5 minutes because this, it's an abstract painting. You just see something different every time. And I'll spend 5 minutes every day just looking at that painting, breathing deeply, and it just changes my entire mood. In addition, you sent me for Chat GPT, instructions on how to have my own therapist, which I have done. And it's incredible. I mean, these are the extra little things that I wouldn't be getting in a primary care setting because, quite frankly, that doctor just does not have enough time for me. All right. Couple more questions. What advice would you give to a physician who wants to make the leap into direct primary care? What's a lesson that you've learned that you might want to share with them, him or her, if they decided to get into the business?
Well, if you've seen one direct primary care practice, there's an old adage that says you've seen one direct primary care practice. So they're all different. So you have to decide why it is you want to do this. You have to decide what your financial needs are because you can start very small. And so there are kids who do this right out of residency program and they do home visits to start. So because they can't afford a physical plant. And so that's okay. You can do side gigs. We do I-693 immigration exams here, which helps augment our income here. We sell a line of vitamins. I mean, you can.
You're a businessman. You're an entrepreneur.
Exactly. So I tell them find out what your goals are, and make a business plan, and then try to follow it. But make sure that you can change as you go along.
I'm assuming in medical school, they're not teaching you entrepreneurship 101.
Never.
And that's a problem too, right? It's not set up to hang a shingle.
Nope. And I teach. I'm a Tufts assistant professor, so we teach the kids, the third-year medical students that come through here. And I've had more than one occasion where the kids were bound to become specialists, and they see what we can do in primary care here, and they say, "Wow, I didn't know this existed. I might just change my mind."
So one of my last questions for you is, and it's a great question. I think I asked this of a lot of people in a different way, but how do you define personal success? whether it's in your practice, both from a clinical perspective, your personal, like, what makes you feel at the end of the day that it was a good one, that it was a win?
If I can go home and feel like I did something good for at least one person, I feel fantastic. And that happens almost every day now. And I can't tell you how little it happened before I started doing this.
So you don't have patients like me coming in asking you what's wrong with you any longer.
Not anymore.
Every time I see you, you always look good. You always got a smile on your face. So that's a good thing. So, Dr. Tremblay, that's all the time we have for today. But how do people contact you or Action Medicine or learn more about DPC? How can they do that?
They can email me at DRMIKE, Dr. Mike, at actiondirectcare.com. If you're interested in direct primary care and you're not in Massachusetts, there's a website called DPC Frontier that has almost all the direct primary care offices throughout the United States. You just zoom in on it and find out where you live and see who's around.
Well, Doc, as always, thank you for being my guest on my second episode ever. I'm sure we're going to have a lot of good feedback from the audience on this one. And also, thank you for always taking care of me and my family as well. I mean, as you can tell, I'm doing much better than what I did when you saw me a couple weeks back when I'm literally bawling in your office. So, folks, that's all the time we have for today. I'm going to sign off. You have been listening to Health Sense with attorney Adam Russo. And as I always say at the end of every episode, go Cleveland.